keen to have a chat with you about this as well, because I think it's something which so many people know, sort of, have to suffer with on a daily basis or have little periods of it, and they're constantly wondering what is actually going on and how do I affect this.
Absolutely. Oh, Mr. Kapoor, I'm delighted to be joined by yourself. It's such a highly revered, skilled, and experienced consultant, ear, throat, and nose surgeon, of course. So, well, Mr. Kapoor, before we get into the questions regarding voice disorders and nasal congestion and hoarseness and such, if you'd like to maybe provide viewers with some background information about your areas of expertise and experience.
Sure. So I'm a ENT head neck surgeon, and I've got a particularly interested in the airway, voice, and sort of lumps and bumps in the head neck. And I work in Surrey in the United Kingdom, so near Gatwick Airport and over near Guildford. And I've been doing this for specializing in ENT since about 2006. So we're looking at a good, let me think, a quick 12, no, 20, 20 or do you know? I can't even do my maths now. 16 years. There we are. Maths is working. 16 years of this.
Very experienced, as you say. I mean, many, many years. So I think your expert insight into voice disorders and how that relates to nasal congestion and throat disorders like acid reflux as well could be very interesting. So, Mr. Kapoor, the first question.
You're right. All of those things are certainly play a big role in the voice, and the voice isn't just one thing. It's actually we've got to think of ourselves as going from all the way from up here, our sinuses, all the way down to our lungs, and all of those things play a part of the voice.
Absolutely. I think it's going to be a very eye-opening interview, I think, with a lot of interesting insight. And the first question we'd love you to answer, what are the most common voice disorders that you see in patients?
Sorry, could you repeat that? I just missed a tiny bit of that. Say that again for me.
Absolutely, Mr. Kapoor. So we're very interested to know the most common voice disorders that you treat in patients.
Sure. I mean, if you think about it, lots of people have heard of things about their voice disorders. Everyone talks about hoarseness, and people might have heard of things like polyps or nodules. I mean, if you think of Adele, our famous singer, one of our greatest exports from the United Kingdom in the last sort of 10 years, um, she didn't sing for a long period of time because she developed a problem with her voice. She actually developed a polyp on her vocal cords. Now, what does that mean? As opposed to just normal hoarseness. So when I think about the voice and I think about people having disorder their voice, I think of things which are structural, sort of lumps and bumps growing on the voice, things like polyps or nodules or cysts or papillomas. And then I think about the other side of things in terms of the function. Is there something which is affecting the way in which they're using their voice, either their lungs, their nose, their throat, and inflammation in that area? So there are two different ways of thinking about it. You think about the things which are physical, which can grow then, and often we have things which do go onto the voice box and sort of grow and change the natural structure of it. And the voice box is basically a really important area which is involved not just in you speaking, but it's also involved in you breathing and also in you swallowing. So all of those things can play a role in voice disorders. And I think about voice disorders, I think about not just things which happen acutely, but something no one can stop. Aging. Aging changes your voice. If we think about Tom Jones, another great Welsh export from the United Kingdom, his voice sounds different when he was singing back in the 1960s to the way he does now. Now, we all know that voices change, but we don't really understand why they change. And that's a normal part of voice change that we see as the thickness and the strength of those muscle changes. We also think about aging in terms of kids. We all might know a teenager whose voice is breaking, especially young men. And that's a normal change in the voice, going from a childlike voice to an adult-like voice, all to do with the lengthening of the vocal cord and the position of your voice box.
Fantastic, Mr. Kapoor. And you mentioned there breathing, and that could actually really impact how we project our voice. And would you recommend patients to, well, really practice breathing techniques, especially if they are using their voice in a professional way or if they're noticing that their voice is getting affected?
You're absolutely correct. I think this is a really good point to make. Let's just think of a trumpet. If you've got a trumpet, and you don't blow hard into one end, the sound at the other end is not going to be as good, is it? So we need to make sure our lungs are in good health and we know how to use our voice. I'm going to give you an example. I'm not going to take a breath and I'm going to keep on talking and talking and talking. And I haven't actually breathed yet at all. And I'm just squeezing my voice box tighter and tighter to try and get the voice out, but I haven't actually used a breath. Well, actually, if I thought about it and I thought about the punctuation, the grammar of a sentence and when I'm speaking, and I thought, I'm going to take a deep breath in there so that I can support my voice and I'm not straining from the thing and not trying to compensate for the fact that air's not going through. That balance is really important. And you mentioned something about professional voice users. Well, there are so many people who are professional voice users. If you're working as a receptionist, you're a professional voice user. If you're working on a telephone exchange, you're a voice user. If you're a TV personality, if you're a therapist, all of these people are professional voice users and teachers. And no one actually really teaches us how to use our voice. We just kind of do it, don't we? It's not like riding a bike where someone holds the back of it and pushes you along and goes, oh, no, do this. You kind of just do it. And so this is the reason why that sometimes when we get into trouble, we compensate and we do things wrong. And that's why sometimes our voice doesn't quite get back as quickly as it could do.
Absolutely. A great point, Mr. Kapoor, about, I think more should be done perhaps then in maybe a young age to actually teach us how to properly use our voice, to properly breathe as we speak as well.
You're quite right. I think the thing is that breathing is also something that whenever you tell someone to take a deep breath in, they kind of do this, and that's not actually breathing deeply because you're closing up your lungs. What we need to do is actually from our bellies to breathe in. And when we breathe in, our tummy should be coming out. And when we breathe in, our tummy should be going in so that our diaphragm is dropping down and that we're really expanding our lungs. But it's not about a really deep breath. It's about that gentle, relaxed flow. And one thing that you might have seen people who are flutists or flautists, I think they're called, they're taught to do is, or if you play the didgeridoo, you might be from Australia and have a nice big didgeridoo that you like to blow on. But there they talk about circular breathing. It's about that ability to breathe and breathe out in a nice smooth motion. And that's what flautists are really important to do. So one thing you can do is think about that gentle, regular breath, which can really help you.
Absolutely. And it leads nicely then onto the topic of hoarseness. And to what extent can breathing lead to hoarseness? Maybe breathing difficulties? Does that cause hoarseness?
Well, let's just think about it. That you're on the phone to one of your friends or family and you pick up the phone and they speak. And within a second, you're like, oh, are you all right? Have you got a cold? Have you got something going on? We pick up so much just by listening to someone, don't we? We kind of hear them and think, oh, there's something not quite right. Well, actually, you're right. Our breathing, when I think of breathing all the way from the tip of the nose all the way down to the base of the lungs, anything along those can affect it. Let's think about our sinuses. If we've got a bit of a cold, we're all congested up here, but actually normally the sound resonates in this area. And if I do this and I speak to you, suddenly my voice is going. And that's not, that's because it's not resonating in those normal areas. And then if we've got inflammation in our lungs and we're not breathing in as deeply, the air which is coming up through the lungs, up through the throat now, is not as regulated as well. There's inflammation there. There's more mucus there. And you can imagine all of these things getting in the way of the voice box.
Absolutely. Yeah, there are quite a lot of things that can actually affect our voice without us really realizing, Mr. Kapoor. And, in terms of awareness for all of these professional voice users, as you mentioned, receptionists to actors to anybody really who uses their voice, how can they become more aware to how in terms of using their voice to the best capacity possible?
Well, I think that a lot of teaching degrees now actually have a speech and language therapist come in or a voice coach come in and talk to you about, breathing, but also simple things that we can do on a daily basis. If you look at the World Cup football that's going on, the Olympics or any sort of sporting event, you see people warming up beforehand, don't you? We don't really think about warming up our voice, but that's a muscle that's being used, and it actually can sort of move from about between 4 and 6 kilometers a day of movement. And if you think each movement is about a centimeter, think about how much work is doing. are we warming it up properly? And there are the simple drills that you can do, and you might have seen people do this la 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 la, all those sort of things, but not trying to push our voice to the back of the room immediately. And then you've got to think about things like what can we do before we even start? Things like hydration. Now, you may have noticed I quickly sipped on a little cup
Yes, absolutely.
of water,
Yep.
warm water. Well, actually, hydration's so important for the voice box. It's amazing, actually. Your voice box is really based upon water. It's your vocal cords need a lot of hydration. The whole of this tract requires hydration. So if we think, if we go back a step a little bit, when we're eating and drinking, if our mouth is dry, things don't go down as well. They seem to get stuck. Well, actually, from our lungs, we're also bringing mucus up, and there are these tiny little hairs called cilia, which are washing them up, these things upwards, and they're coming out, and then you're swallowing them. Now, if they're not hydrated, they're going to be stickier. And the way that I'd make you think about this is, if you think of a pan that you've got that you're heating a sauce up on, and you keep on heating up, and the water evaporates and evaporates and evaporates, that sauce is going to get stickier. And so it's going to stick in your throat more. And therefore, you're going to have to clear your throat more. And clearing your throat, that sort of thing that we do, is actually really bad for your voice box. So what you're doing there is you're actually getting the vocal cords to rub against each other, and you're doing this to your vocal cords. And if you think of anything which is rubbing against each other, it's going to get a little bit more sore and a little bit more damaged. And what we should really be doing, if we've got that feeling of a bit of mucus here in our throat, is we should be sort of turning our head to the side, chin forward, head up, and going, open the mouth and going, okay, so almost like pushing the air out. And why is that? Because then we're opening the vocal cords, not getting them to rub against each other, and pushing that mucus out. And then if that doesn't clear it, you can have a little sip of water to help clear that area out. And these are those simple things that you might be able to do instead of trying to damage your voice box.
Absolutely fascinating, Mr. Kapoor. I mean, this technique that you say people mightn't be too aware of it, so it's really informative that you're really demonstrating how to avoid damaging our voice box when we have irritation. We want to, do that clearing of the throat or the coughing and to get relief. And you mentioned hydration, being dehydrated, a big factor. And what would you say in terms of home remedies, herbal remedies like ginger or maybe green tea? Are those effective for voice disorders?
Well, that's really interesting. I think that often we sort of look down upon home remedies. I think, oh no, it's got to be medicated. It's got to come in a packet, and it's got to have a big stamp on it. And I actually would say to you that home remedies can be really quite helpful. Lots of people talk about lemon, ginger, and honey. So if we look at all of those and see what are their relevant things, well, if we look at honey, honey's a very well-known antibacterial. It has properties in it which are also anti-inflammatory. And if we've got inflammation and we're taking that honey, it can help there. It can help with pain. So often after tonsillectomy, we say to people, you should be sucking on some honey. So honey in itself, really helpful. People talk a lot about manuka honey, which comes from the tea tree oil plant, the manuka flowers. And that's said to have an even greater anti-inflammatory property. But, just normal bog standard honey from your local producer is very, very good for you as well. When we think about lemon, there's this whole discussion. Well, actually, vitamin C has been shown to really help in viral illnesses and reduce the length of viral illnesses. So there are lemons giving us some vitamin C. And ginger, really interestingly, there was a study done showing that actually ginger can help prevent viruses getting into cells. So all of those three items, in some warm water or hot water and then allowed to cool a little bit, could be really beneficial because you're hydrating yourself, you're giving yourself a little bit of that, all those properties there, which are going to help speed up your recovery, as opposed to things like tea with caffeine in it. And one of the problems about tea and caffeine, I'm going to be honest with you, every morning I have a nice cup of tea and I'll probably have a cup of coffee every day as well. Now, they don't actually hydrate you. They dehydrate you because caffeine is something which will make you pass urine. And also they have things like tannins in them, which can be slightly negative towards the cord. So if you do have that thing and you want a nice warm cup of tea, well, actually the herbal teas or the green teas are also shown to be a little bit anti-inflammatory as well. So maybe think about the green teas rather than a nice cup of Builder's brew as I have in the morning.
Absolutely, that's brilliant, Mr. Kapoor. It's so hard to avoid the coffee and the caffeinated tea, but for the voice, you would recommend some herbal teas, like the green teas, and
Yeah, I'm not saying don't have any tea or coffee at all, because look, they can be, something that makes us feel better is really helpful as well. But if we're purely relying upon the sort of caffeinated things, they can actually dry the throat out a little bit more as well. And one other thing people like to do is have things like these, sort of throat lozenges with sugar and things like that in them. I'm not really a big fan, and I'll tell you the reason why. The reason is that they've got lots and lots of sugar in them. And what happens with sugar is that can actually feed any bugs which we have in our throats. It can increase the risk of candida at the base of the tongue. So if you are going to have throat lozenges, and try and find one which is sugar free. And I think those are better. There are some really good pastels called vocal zone pastels, and very openly, I don't have any shares in this company. I don't have any benefit from it. But there are lots of different pastels there which are non-medicated, and a lot of singers use vocal zone pastels, and that's a brand name. But I'm sure there are lots of other ones as well which are not sugar based, and they can be really quite soothing for the throat.
fantastic, fantastic, Mr. Kapoor. Very insightful. And then I suppose we might touch now on the surgical aspects. When might surgery be required for people with voice issues?
Well, that's really good. Ideally, as a voice surgeon, I do a lot of operating on the vocal cords. You really don't want to touch the vocal cords. The vocal cords are very delicate, and we do everything we can to avoid surgery. And before we get to surgery, we'll usually work very closely with a speech and language therapist. If you had a bad shoulder, it's very normal for us to go to a physiotherapist and say, "Oh, they're going to give us some exercises to do to get my shoulder a little bit stronger." Well, similarly, for your voice, we work very closely in voice clinics collaboratively with a speech and language therapist who's going to give you some exercises to do for your voice box, how to relax certain muscles, how to improve the efficiency with certain muscles. And that's really important. I'll give you an example. And I'm going to talk about surgery, but just I think this is quite important for us to really think about. Let's say I write with a pen and pencil, and I hold my pen. I don't have one in my hand, but with two fingers like this, and I write. But I've damaged my finger, and so what I do is I start holding it with these fingers. So it's not my normal muscles that I'm using. That's going to put more tension in my hand because I'm using new muscles to try and do the same thing. And that's often what we do when our throat is not feeling well. We'll try and strain our voice to get a voice out. And then we get into the habit. We formed a new habit in how to create voice. And what our speech and language therapist is doing is trying to relax the wrong muscles and get you to use the right muscles again. Particularly people often, when they've got a bad voice, they whisper. Whispering is possibly the most negative thing to do for your voice box because it's putting more tension across your voice box. So a speech and language therapist will work with you, give you techniques, talk to you about breathing, talk to you about resonation, talk to you about how to relax that throat. We then, as ENT surgeons, will have a look at the structure and say, look, if despite that there are things which are going on the voice box which need surgery, we'll then think about surgical approaches. And most of those surgical approaches for hoarseness are done through the mouth. And it's usually a day case procedure. You come in the morning and you go home the same day, and we'll look to use very, very fine, long instruments or even a laser to try and treat the lesions on the voice box. But your voice box is very delicate, and it requires a lot of skill and a lot of practice to get this done right. Damage to the deeper layers, and your voice box is 5 layers of lining. Think of it like an onion. And what we're trying to do is make sure that we don't hit the deeper layers. And actually, you imagine it's not onion size, it's much smaller. So those layers are very close together. We're really trying to protect those layers because ensuring those layers' integrity improves the voice outcome later on. And so we have to be really thoughtful. And once you've had a procedure on your voice box, most surgeons will say to you that we want you to have absolute voice rest for about 48 hours. So what does that mean? Well, absolute voice rest usually means you not speaking at all for 2 days. And I joke with my patients and say, you can only say fire or help for the first 2 days in order to try and put it. But because we're so used to all texting these days,
Yeah.
you can text people and you can WhatsApp people, and that's allowing that area where we've possibly made an incision on the vocal cord to heal. Just like if you had a cut in your hand, we put a plaster on it to stop it opening up. Well, we can't do that on the voice box, so we need to get you to rest it. And then when we're doing that, we're also going to be asking you to do a lot of steam inhalation and be well hydrated to help that area heal. And steam inhalation can be really helpful because it helps those tiny little hairs we talked about, those cilia, to get rid of the mucus and clear the throat naturally. And then gently for the next 2 to 3 weeks, we'll often say that we want you to slowly start increasing the amount that you use your voice, making sure you don't whisper, and importantly, that you don't shout. So those things will really help the vocal cords to heal after a procedure.
Fantastic, Mr. Kapoor. And very interesting there, you mentioned a steam inhalation. I've often been in steam rooms in leisure centers and at swimming pool areas, and it is very therapeutic for the voice and for even the breathing. What extent does it really impact the voice in a very positive way, I'd imagine?
Absolutely, you're quite right. And I've been in those steam rooms as well. And you feel so nice, don't you, afterwards? You kind of suddenly feel things opened up, especially around here, around the head area. So they, oh God, I can breathe better. Well, actually, that's really right, because your sinuses, something that people don't often realize is we're making about a litre of mucus a day from our sinuses, and then we're swallowing it. Now, I know that sounds a bit disgusting, but we're all doing it, so it's not disgusting. Okay? But that what really helps is that there are tiny little hairs in there, these things called cilia, the same things on the top of the lungs, and they waft. I think of it like a field of wheat wafting the mucus backwards, and and it needs to be hydrated. And when you have steam inhalation, you're going to be helping that area out by allowing that hydration from the top, breaking up those little bits of mucus, allowing them to pass down more clearly, allowing the sinuses to drain more clearly, and therefore your sinuses will resonate more, things will slip down the throat more easily, and it will also help the lungs and get the mucus up and out more clearly. So those really, really helpful things to do. And you don't need to go to a sauna or a steam room. You can do that at home with a simple bowl of hot water and a towel if you need to, or when you're having a shower, close the window, close the door, and just spend an extra minute in there. I know with the cost of living crisis and the heating, we may need to be all taking shorter showers, so maybe don't do that last one. But those things can be really quite beneficial. Equally, some people, and I'm going to say I do, and I get my children to, is use something called salt water nasal washes. Sounds a bit weird, sounds a bit strange, but washing your nose out with salt water, and this isn't a jet wash, so we're not looking to go down to the local car wash and aim it up our nose and wash it out. No, this is a gentle irrigation of the nose with salt water, really helps that process. And it's been shown to reduce coughs and colds and really reduce nasal congestion. We know that when we're congested here and things slip down the back and we've got that feeling of like something falling down onto our throat, we're going to reduce that, which will reduce our throat clearing and that need to clear our throat and irritate the vocal cords.
Absolutely. And nasal congestion there, you just mentioned there, Mr. Kapoor. I suppose it has a big impact on our voice and how we get affected by different voice disorders, as you say, when the sinuses get blocked. So I suppose, what is the relationship between nasal congestion and hoarseness and voice disorders in general?
Well, look, you're quite right. There is a big connection, and there are a couple of things. Firstly, we're swallowing that mucus, that 1 litre of mucus that we're creating every day, and if anything that which will thicken and slow that mucus down will obviously sit on the voice box more, and we'll have to clear it, and that'll affect our voice. But equally, there's something called the one airway hypothesis, and many people who are asthmatic might not realize this, but they kind of internally know this, that if your nose is bad, your chest feels bad. And the reason is inflammation in the nose leads to the release of cytokines and interleukins, and these are part of your inflammatory cascade, so how your body tries to protect itself against inflammation. It releases these chemicals to say to the cells next door, oh, look, there's something going on, there's inflammation, let's protect ourselves, let's make sure that we're not going to get more ill. And when it releases it here, it goes into the bloodstream, and then also it affects here. And because the lining in your nose and in the top part of your breathing pipe is the same, the cells here go, oh, there's a bit of inflammation going on, let's protect ourselves. And then they get a little bit tighter. So we know through lots of research that if we look after the nose, we'll also be looking after the chest. And all of those things are part of that vocal cord tract. A tract meaning, and that's going from the nose all the way to the base of the lungs. And we're just trying to improve the health of it. So if you do have a cold or a chesty cough, look after both sides. And that will also look after your voice box.
Absolutely. And would there be anything you recommend, Mr. Kapoor, in terms of nasal congestion problems, nasal sprays, or what would be the most effective way to relieve any congestion?
Well, number one, I would not recommend over-the-counter nasal decongestants. Things like Otravine or xylomethasone, these sprays that decongest the nose rapidly. They are brilliant at what they do, but they're very bad for you. And they will cause damage to the lining of the nose. And this is where that problem arises. It's something which seems really good and helpful, and the doctor's saying, well, that's not good for you. It's because of the long-term effects. You're sort of papering over the problem, damaging the lining, damaging the blood supply to the nose, and it can lead to long-term. It's those simple things. We talked about the over-the-counter remedies of things like, the home remedies of things like hot water, honey, lemon, ginger, those sort of things, really hydrating yourself, taking regular paracetamol, the salt water washes. And if you've got a history of nasal congestion, your GP or your ENT surgeon might have given you a steroid nasal spray, and they can really help to manage that area. Equally, if you've got a known lung condition, making sure that you're taking your medications regularly. And if you need to, if your lungs are not doing as well and you think they're a bit weaker, sometimes the healthcare team might be advising you for a spacer device. So those inhalers that you're taking, which help your lungs out, go through a spacer, which makes it easier for you to breathe in. So my number one tip would be: do not take over-the-counter nasal decongestants. They are bad for you. Maximum of 3 days ever is what I tell my patients.
Fantastic. Very, very helpful advice for sure, Mr. Kapoor. And I suppose then acid reflux, and I suppose nasal congestion and acid reflux might be two conditions that really affect the voice. To what extent can acid reflux affect us?
Do you know what, you've sort of hit on a really good topic there, and something that we all kind of are aware of. And we don't really think about how it affects the voice. A lot of people talk about heartburn and think, oh God, I've a bit of discomfort here after eating. And we always think about acid reflux. Well, actually, I'd like to ask for you to think of it in a slightly different way. And I like to call it, its technical name is gastroesophageal reflux disease, or GERD. When it affects the throat, we call it laryngopharyngeal reflux disease. Laryngo means your larynx, your voice box. Pharynx meaning your throat. And it's not just acid. Acid is about 70% of what washes up and is irritating the area. But there are two other very important constituents to what comes up, and that is bile and pepsin. Bile breaks down fats and these little salts which irritate the throat, and also pepsin, which is there to break down protein, and that can also affect the throat. And so when we just think about antacids, and people take antacids, that's not the only thing that's going on. What's it doing? Well, what's happening is every time we burp, we're bringing up a little bit of that acid, bile, pepsin, and maybe even some of the food into the back of the throat, and it's causing irritation and inflammation. Imagine if I took the back of my hand and I dropped that on there every day, you would imagine the back of my hand to get rather sore. Well, that's exactly what's happening here in the throat. That's a big part of when we're feeling unwell, that actually we've been having that trauma to our throat, but we've been healing. But something else comes along, like a cough or a cold, and it damages the lining more. And then that acid, bile, and pepsin is getting in deeper into that area. And that's why it's really important to do some simple things to try and help this. What can you do? Well, try not to eat for about 2.5 to 3 hours before going to bed. Because you imagine that your tummy and your throat are going to be at the same level when you're sleeping. We know that all our muscles relax when we're sleeping, and there's a muscle at the bottom. It's not a valve, it's a muscle, but we can think of a valve at the bottom and at the top of the swallowing pipe. And if they both relax and open up, things will wash up back into your throat more when you're asleep. And therefore, if you've spent 3 hours not eating before going to bed, less food will be in your tummy, so less will wash up. The next thing that we can do is we can think about a wedge pillow, a pillow underneath us, not just under the head, pushing the head forward, because that will give you neck pain, but a sort of triangular pillow called wedge pillows we can put, which go from our lower back all the way up, that give us a bit of an incline. So then whatever washes up has to go against gravity. Other things we can do is try and avoid fizzy drinks after 5 o'clock in the evening, because that sort of fizziness, or that carbon dioxide which is created there, will create more bubbles, will create more gas, and we'll be burping that up. Now, many people might say, yeah, but I don't get any symptoms of reflux. This isn't relevant to me. Well, actually, we know that about 20% of people have what is called silent reflux. So we'll put a camera down your nose, have a look at the voice box when we're in clinic, and we'll see bumpiness at the back of the throat, or redness around the base of the vocal cords, or the area looking like you've been in the bath for a little bit too long, and everything looks like, when your fingers get all wrinkly, there's an area between your voice box which gets it all a bit wrinkly, showing the signs of this sort of reflux. And then what you can do if those simple things haven't helped is things like Gaviscon Advance at night before going to bed. And literally the last thing you do before you brush your teeth, you have a big glug of Gaviscon Advance, big tablespoon of that, and then brush your teeth and go to bed. No water, nothing on top of it. And that forms almost a coating, but a lining, a raft in the tummy to stop things washing up and coming up and back and irritating the throat. And you can do that for maybe 2 or 3 weeks. And that might really be able to have an impact on speeding up your recovery.
Fantastic, Mr. Karan Kapoor. I mean, that was a very insightful, informative interview for everybody watching and listening in. So thank you so much for your time. And if anybody wants to find out more about acid reflux, nasal congestion, or voice disorders, or anything affecting the ear, the throat, the nose, you can check out Mr. Kapoor's Top Doctors profile at www.topdoctors.co.uk. And for now, Mr. Kapoor, thank you very, very much for your time.
Thank you very much. Real pleasure to see you this morning. Take care.
Thank you very much, Mr. Kapoor.